Dear friends, today I want to talk about a very common disease which troubles the people called fissure in ano. Fissure is nothing but a linear wound or a cut. It can happen even in your feet and all, we call it as fissures. So, fissure is a small cut. So, why does it happen? So, in the anal canal, there are two rings of muscles called sphincters which will be keeping the anal canal normally closed. And above that, there is a rectum where motion comes and collects. So, when the rectum gets completely filled, we get the sensation of passing stools. That time, anal canal, those rings of muscle should relax and open. Then, rectum squeezes, motion comes out. Due to various reasons, for some people, instead of opening this much, it opens only this much, it will be tight. So when the sphincters are tight and not relaxing, and if the motion is hard that time, when it is coming, it will tear and come out. The tear is called fissure. It's about 1 to 1.5 centimeters cut will be there at the edge of the anal canal. And that causes a lot of pain. Because it's a cut, it causes a lot of pain. While passing stools, maybe it may last for about 15-20 minutes, half an hour, and usually it subsides. And if the constipation is not there, then it will heal by itself. So if initially when it happens, we call it acute fissure, and the treatment is always what we call as conservative. No surgery further. So we give medicines, and make the stool soft and all that, so that again and again it will not happen. But for those where the constipation is quite common and the sphincters are quite tight, so they will be getting repeatedly, or it will never heal. Always it will be every day they are suffering from pain or little bleeding. And most of them will have some streaks of blood on the motion as it is coming over the fissure. So when it is there, if it is there persistently, we do some small procedures to relax the muscles so that motion comes out easily. The very simple procedures are available, and once it is done, you will get rid of it permanently. And the other indication for fissure for surgery is sometimes infection happens beneath that fissure and it will not allow it to heal. So that time it is not only for the fissure, even to clear the infection, we do surgical procedures. So whenever there is that painful anal condition, usually it is not piles. Many people think when they have pain, they think that they come and tell, I am having piles for so many years. It is not piles. Piles will cause bleeding or swelling, but usually not pain. Piles causing pain only if there is a clot inside the pile mass. Otherwise, most of the times, especially if it is burning type of pain, pricking type of pain, and only during passing stools, it is usually because of fissure. So, how do we treat medically? So, it is because of the constipation, motion has become hard. So we give something called stool softeners. Some medicines will be there, some syrups, that sort of thing, to make the stools soft so that it will come out through the tight sphincters without causing any injury. And for the wound to heal, we will have some and allow it to heal, and the muscles to relax there. We have some creams which contain one local anesthetic on the wound so that it will reduce the pain and patient will relax the muscles easily, because when there is pain you can't relax the muscles, it will go in for spasm. So, and then there is one more medicine in that which will relax the sphincters. So this is how we use one cream, one syrup or some powders and all to make the stool soft. Then if there is infection, we may add antibiotic, and if the pain is severe, we will give painkillers along with that. So this is what we do for medical management, conservative management for acute fissures, or patients who have got fissures very rarely, once in a year they get some small fissure, we can treat that way. Whereas those who have got fissures for more than 6 weeks, 12 weeks, and suffering a lot, there is no point in treating them with all these medicines for life, because they have very tight sphincters. That is the root cause of it. So we have to loosen the sphincters. There are two ways of loosening the sphincters. One is we do what's called sphincterotomy, where we cut the sphincters, part of the sphincters, so that it will relax. Or we stretch the sphincters in a very defined manner and make it normal size. So either way, depending on their training and their experience and their belief, surgeons use these techniques to make the sphincters normal, so that motion comes out easily. Even if there is a little constipation, without cutting, it will come out. So these procedures are so simple, and the relief for the patient is immense, who is suffering with a lot of pain. Very next day they get relief when they are passing motion. And the surgeon also, there is not big surgery there. So that cutting can be used, you may use laser, you may scissors, there are different ways of doing it. So if it is done properly, the results are excellent. So don't go on delaying for the fear of surgery, and be managing fissures. Fissures are the simplest, and I don't even call it as a disease because it's a simple cut. It's an injury actually. So you can treat it very easily and get rid of it rather than suffering for very long periods.